don't you go ahead and introduce yourself and
Sure.
what this is about?
Yeah, so my name is Katherine Gallardo, and I'm with UT Health, and it's a part of a study where we are speaking with professionals that work with individuals experiencing chronic pain.
Okay.
And we really just want to know more about what you do and how you address individuals that are experiencing chronic pain.
Okay.
So if you could just tell me what your role is in relation to people's experience of pain and
Yeah.
how you came to do this type of work.
Well, there's a couple of questions there. Let's see. I'm a chiropractor, licensed in the state of Texas in California, and I went to Palmer College of Chiropractic in Davenport, Iowa, which is the first and largest chiropractic college in the world. And I received my Doctor of Chiropractic degree on June 30th of 1981. And the reason I became a chiropractor, this will probably really surprise you, but the reason I became a chiropractor is not because of neck pain or back pain or pain at all, really. It was because in the 6th grade I was playing with my sister on the couch and fell off the couch backwards and hit my head on the coffee table and kind of gave myself a reverse whiplash.
Oh, wow.
And within 3 months' time of doing that, I started developing severe asthma. I never had asthma as a child, ever. But then now, all of a sudden, after this accident, I have asthma.
Oh, wow.
So my mother took me to all these medical specialists, and all they were doing is giving me medications, cortisones, inhalers, epinephrine injections. I had to go to the hospital and get put in oxygen tents and shot up full of epinephrine to get my breathing going because I'd totally lose my ability to breathe. I was heavy into sports. I had to quit playing all my sports activities and even PE. I couldn't even participate in PE.
Oh, wow.
So finally, my mother took me to a chiropractor, another Palmer graduate as a matter of fact, and within 3 months' time of getting my cervical and thoracic spine adjusted, my asthma completely vanished. No more asthma, no more they said my asthma was due to severe allergies. They were giving me allergy shots twice a week for 2 years from the 6th grade to the 8th grade.
Oh, wow.
I was getting worse the whole time. So within 3 months' time of starting to get adjusted by this Palmer graduate chiropractor, I had no more asthma, no more allergies, no more medications, and I decided in the 8th grade I was going to become a chiropractor and not a medical doctor, specifically because drugs did not work, the medical orthodox approach did not work, and chiropractic did work.
Oh, wow.
And it really, changed my life.
I mean, it
Saved my life, really. That's why I'm doing this.
You definitely see you have a passion.
I'm very
for this
passionate for it.
Wow, that's wonderful. And I guess, so...
And we see a lot of pain patients. I mean, that's really the #1 reason that people come to see us is for spine pain or extremity pain, shoulder pain, neck pain, back pain, pelvic pain, sacroiliac joint pain.
Okay, so it's just
Multiple types of pains, and chronic, of course, is duration over 3 months. So chronic pain patients are patients who have been suffering from a condition for over a 3-month period. And we also see acute pain patients, like have been involved in a motor vehicle accident, sustained a whiplash or lateral flexion injury or hyperflexion, hyperextension injury. And they have acute pain, which is a sudden onset of pain in a duration of less than 3 months. And we see both types of patients. And a lot of people really don't understand the difference between medicine and medical approach and chiropractic approach because they've been indoctrinated their whole lives to see orthodox medicine as the kingpin of healthcare. Well, I think you probably agree with this. Medical doctors think in chemical terms. Okay, so you go to the medical doctor for neck pain, let's say, chronic neck pain from an accident you had when you were a teenager, but you still got neck pain and headaches. So what's he going to do for you? He's going to write you a prescription, right? He may send you over to physical therapy. A lot of MDs are now starting to refer to chiropractors because they understand the benefit of what we do. But chiropractors think biomechanics and proprioceptive neurological bombardment into the cerebellum, which is 80% of the brain function and control of the human body. That's a lot of people don't realize that either. So we're not really pain doctors as chiropractors. We are influencing the biomechanical system of the human body, including the spine and the nervous system, to change the neurological proprioceptive afferent input into the cerebellum, which then reconnects that down into the spinal cord, into the lateral spinal thalamic tract, out through the peripheral nerves to whatever organ, muscle, tissue, and cell those nerves supply, improving their function.
And I guess so.
So it's how we stand up three-dimensionally and function in gravity. Okay. So really, gravity and function is what this is all about. It's how we function, stand, and live our daily lives in gravity. We're either lined up biomechanically correct, where we're getting normal neurological proprioceptive input into the cerebellum, and then back out, afferent, efferent nerve supply, and then normalizing that function through appropriate biomechanical alignment of the vertebrae of the spine and the pelvic bones. So we're influencing the nervous system through biomechanical correction, and the job of a chiropractor is to detect and then correct those biomechanical improprieties, which we call subluxations. That terminology is frowned upon by most medical doctors. They don't believe in it. They think it's an archaic, unrealistic term. What that really means, a subluxation is less than a total luxation. If you separated your shoulder completely, that would be a total luxation of your shoulder. But if you just hit it, for instance, we take care of a lot of NFL players. When they jam their shoulders into tackling somebody or getting tackled and they misalign their shoulder, that's not a total separation or misalignment of their luxation. It's a subluxation. So we detect those and then correct those, normalizing the proprioceptive neurological input into the cerebellum, which normalizes function and therefore deals not only with pain but also blood flow. I mean, for instance, how many senses do you think we have as human beings?
Traditionally 5, but I mean,
okay, traditionally 5, right? Okay. Can you smell it? Can you hear it? I've got my finger here. Can you smell it? You can?
No.
You can't smell my finger, right?
No, not.
Can you taste it?
Not currently.
Can you see it? You can see my finger behind my back?
Oh, no.
Okay. Can you hear it?
No.
Can you touch it?
No.
But I can through proprioception. My brain knows where my finger is. That's what proprioception is.
I see. Wow.
It's pretty heavy duty thought process. It's sixth sense, basically.
Wow, that is. That's the first time somebody's introduced that to me.
Yep.
And so you'd mentioned that, so I'm curious, do you get a lot of referrals from medical physicians?
Yes, we do.
Okay. So it seems like, I'm wondering if there's a shift. Have you always gotten a lot of referrals?
No, we have not always. This is it's a newer phenomena, and it's the more progressive physicians who are really current on the newest science. Because all this information I'm talking about to you right now, it comes from the medical literature and research. It's not chiropractic research, studies that have been blinded for chiropractic adjustments. This is actually coming from neurophysiological studies, neuroscientists, orthopedic surgeons, neurosurgeons, Guyton, for instance, or Guyton's physiology, Fuentes. I mean, there's just most of the things that we do as chiropractic is scientifically referenced in the medical literature. It's just not commonly thought of by physicians because most of them don't really know all this.
I see.
I mean, really, the neurosurgeons and neuroscientists and people who are dealing with this all the time, they understand it. So those are the people we get more referrals from, the ones who understand what we do.
Gotcha.
The ones who just think we're cracking necks and cracking backs, you know, they don't like us because when they come see us, they're not going in and getting their drugs. They're not getting their prescriptions.
And I guess, so what does the first visit look like for a new patient?
Well, we do an intake just like you would when you go in to see a physician. We do a history, review of systems to see if there's any health conditions going on, you know, heart, lungs, gastrointestinal system, liver, kidney, diabetes, high blood pressure. You know, we go through a thorough history, a history of if there's been any accidents or traumas in their past that may have contributed to these biomechanical improprieties that we're looking for. And then we also find out what their symptoms are, you know. Why did you come to see me today? Well, I have severe neck pain that I've had for the last 10 years. And I've already had surgery on my neck, and I still have neck pain. And I still have pain that runs down my arm. That it's the reason I had surgery in the first place. So we see a lot of that.
And have you seen, so you mentioned you see acute and
chronic,
patients.
yes ma'am.
And so, I guess, are there points where, I'm assuming, you know, when acute injuries eventually progress to
chronic, yes ma'am.
Potentially points where you could have, you know, if they had come to you
initially, then they probably could have avoided becoming a chronic patient from their acute injury that they sustained. And see, the old medical model for most trauma cases is what? Bed rest. Right? Okay, you need to go home and bed rest for 2 weeks. Or wear this neck brace. That's old hat. That's old medicine that is not effective, that actually causes more damage than it does good. They now know that movement is the key to rehabilitation, physical rehabilitation. And movement is exactly what we're talking about here with the correct three-dimensional biomechanical proprioceptive input into the cerebellum. Because if you don't have movement, you're not stimulating these proprioceptive neurological afferent impulses into the brain. So immobility actually creates more pathology and neuropathology than does movement. And what we do as chiropractors is we adjust the spine, the vertebrae or the pelvic bones and or extremities, and we put them back into a better biomechanical relationship with the adjacent bones that they are supposed to be attached with. For instance, the glenohumeral joint. You know, if it's misaligned, I would align the shoulder joint up, the humerus, and the head of the humerus with the socket part of the acromion process. And that would change the proprioceptive neurological input into the brain, therefore changing the biomechanics and the function of that individual.
Wow, that's really interesting. I mean,
it's a lot more entailed than a lot of people have ever thought about.
Wow, and I guess just curiosity, you mentioned some of your patients have had experiences with receiving prescriptions for opioids and kind of went down that road, and now they've come to you. Can you talk a little bit more about that?
Well, yes. As you know, opioid usage is a huge problem in the U.S. right now. I was just looking at this CDC document here a little while ago.
Yes,
overdose deaths involving prescription opioids have quadrupled since 1999. And so have the sales of these same prescriptions. And from 1999 to 2015, more than 183,000 people have died in the U.S. from prescription opioids overdose. That's just opioids.
Yeah,
that doesn't include.
Alarming statistic.
It's alarming, and it's become a big problem in the United States because what's the Orthodox medical model for taking care of your pain?
Give a prescription.
You get a prescription. Most of the time, you get a prescription.
That is very true. I mean, that's seems like that's been the trend for a long time, and now we're kind of starting to have more of an awareness as a society of trying to shift the paradigm of.
Well, and that's why chiropractic has grown in its popularity and its usage by the public too, is because people are starting to realize that the drugs aren't helping them. They're not even getting rid of their pain when they take them.
Right. Wow.
Because you get a rebound phenomenon a lot of times when you're taking these things. When you take them, you start building up a resistance, you know, and you have to take more and more of them to get less pain. But then eventually you get what's called a rebound phenomenon, where it comes in, you got even more pain no matter how much you're taking.
Oh, wow. And has that been, I guess...
There's a lot of studies on that, right here. It's in Cover Time magazine.
I know it's getting a lot of media attention right now.
It is.
I mean, do you...
Here's drug deaths in 2016, opioids rising. I mean...
There's a lot out there.
There's tons of stuff. And I brought all this for you just for your...
Thank you so much. And do you encounter a lot of patients that disclose that, you
Absolutely.
What does that look like? Or?
Well, we as chiropractors are a drugless and surgeryless profession. We do not advise patients to take drugs, nor do we advise them to not take the drugs they've been prescribed. Our goal is to improve their function naturally, and then they can work out reducing or getting off of those drugs with their medical doctor, which is what we encourage them to do. It's not our job to take people off medication or prescribe medication. In fact, that's not even in our scope of practice.
Right. But have you, I guess, the people that you've worked with,
well, it saved marriages.
have there been cases where you've been able to work with them over a period of time and, you know, they've been able to get off?
Yes, absolutely.
Oh, wow.
And it's usually not a long period of time, because once they start feeling better and functioning better on an everyday basis in their normal everyday activities of daily living, and they don't feel like they have to take 5 narcos a day just to get by, they go tell their doctor, hey, I'm feeling better, can you get me off this medicine? Because most of them are chemically dependent on that medicine at that point in time, because they've been taking it for a considerable amount of time.
Right.
So they're not, you know, addicts per se, but they're chemically addicted to it, or chemically dependent upon that medication because of the opioid receptors. Interestingly enough, the adjustments that we do and the manipulations that we do on the spinal biomechanics, they influence the same opioid receptors that the drugs do.
Really?
Yes. So we're actually replacing that neurobiochemically, because the cerebellum controls the hypothalamus, which is the chemical part of the brain that is responsible for what we call homeostasis. Homeostasis is where your body internal environment is functioning in a total state of health. So really, we consider chiropractic as health care, as where we consider medicine as more sick care.
Wow. That's the first time I've heard that. It's really interesting.
So, I mean, we think, and I personally consider, and so do a lot of the top chiropractors in our profession, think that chiropractic should be the primary portal of entry into the healthcare delivery system, because we're drugless and we're surgeryless. If you could, okay, I'm going to use an example here. If I shut that great big door on your hand right here, okay, and you had 2 choices. One, you could see your medical doctor and he could prescribe you all kinds of drugs to try to get rid of that pain from your hand being stuck in that door. Now your hand's still stuck in the door, you're taking the meds, it maybe dulls the pain some, but your hand's still stuck in the door. Or would you come to see a chiropractor who's simply going to open the door and take the pressure off of your hand?
Yeah.
You see the analogy?
Yes. Definitely. Wow. And I guess, what are patients' expectations that have dealt with chronic pain for many years when they come to your door? I mean, what do they?
That's a great thing about what we do. a lot of time patients' expectations, they're coming here a lot of times as a last resort before they consider having another surgery or getting into more heavy-duty narcotics. Their expectations are fairly low because they haven't had anything that's been able to help them medically. And then they come to see a lowly chiropractor. You know, they think, a lot of people in the, I guess, U.S. or this medically indoctrinated society we live in consider chiropractors secondary in education and expertise to physicians, medical doctors, because of what they consider to be inferior education or inferior whatever. I don't know, because we have a top-notch education, as you can tell. I mean,
Definitely.
So their expectations are low. So we usually not only surpass their expectations, but gloriously exceed their expectations. In fact, we hear that all the time from people coming into our office. Oh, you have far exceeded my expectations of what I thought could ever happen. I have never felt this good since I have had this condition.
Wow.
I mean, life-changing experiences.
Oh my goodness. And
I mean, if you had chronic low back pain for like 10 years, and your job was you got to bend over and lift and pick up bins at your work, you probably wouldn't even be wanting to go to work. And a lot of people don't go to work, and it, you know, back problems has for years been the #1 cause of disability in this U.S.
Oh, wow.
Because that's the #1 thing that keeps people from being active and working. So when we get people functioning better and feeling better to do their normal everyday activities of living, they can go back to work, they can have a normal relationship with their family, because this interferes with relationships with families and children. And
goodness. I mean, and you touch on the big, I guess, the psychological component to just dealing with pain every day. Do you see?
Well, it causes severe depression too.
Yeah, depression, anxiety.
Yeah, and what do they do for that? More drugs, right?
Yeah.
So, you take your pain pills and stuff for that, for your chronic pain, yet that's not going away, so now you got depression, and now you're taking depression drugs on top of your opioids, or whatever else you're taking. So you're just so medicated, your body's not functioning normally or innately. We call it innate. It's an innate function. Homeostasis is innate. That's the body's internal well-being and homeostasis that keeps us in a healthy state. If we are not in 100% homeostasis or close to it, then we are in dysfunction. And one way or another, and that can be physical, mental, psychological, even chemical, because of the neurotransmitters and the neuro.
And do you notice a shift in their, I guess, a shift psychologically with, like, just from seeing them over the course of a couple of weeks or a couple of months?
Absolutely. Not just them, but their family members, their wives, their children, all say, oh, Daddy can play with us now.
Oh, wow.
You know, we have a normal sex life now.
Yeah. Wow.
You know, I can talk to my husband now without him complaining 24/7 about his back hurting. I mean, it's life-changing.
Yeah, it definitely sounds like you have an immense impact.
Yes, it is.
The work that you do, that's incredible.
And it's a pleasure to come to work every day.
Wow, thank you so much for sharing. That's, gosh, it seems like.
Well, this is my passion.
Yeah, I can tell. And I guess just kind of moving forward, thinking about this big opioid issue that we've encountered now, that as a society we are now more aware and really needing to explore other.
And it's not just opioids either. It's acetaminophen, it's ibuprofen. All those things have been found now to cause serious physiological adverse effects, like kidney damage, liver damage.
Wow, that's a very good point.
Even PPIs that patients take for acid reflux and hiatal hernia and things of that nature have been linked to kidney disease and dementia now. And that's through medical research. That's not a chiropractor saying that.
Goodness. Well, I mean, so I guess with everything we know now, what are some things that you think are important to educate the public, physicians, you know, just policymakers, how to move forward and
That's a really good question, and I think it really comes down to being able to speak with educators, lawmakers that have an open mind and are willing to listen to the medical research that shows what we do in the chiropractic profession actually influences the body in such a positive way. You know, because a lot of them don't realize that. They grew up under the medical Orthodox model as well.
Right.
You know, a lot of them don't even know what we do as chiropractors. You probably didn't even know what we did as chiropractors until I just explained it.
Yeah, I had, you know, I grew up going to chiropractors in my family, so I have a sense, but I mean, nobody's ever broken it down to the physics behind it, so yeah, it's been very fascinating to learn about. I mean, and do you think that, I mean, it seems like because you're in a profession where individuals don't need a referral from a patient to see, I mean, from a physician to see you.
That's correct. We're a primary portal of entry into the healthcare delivery system.
So is there a need for education of the general public on of what you do and how you can help?
Absolutely. But it needs to be from educated, committed, dedicated chiropractors like myself and others in our profession who understand the neurophysiology and the biomechanics behind what we're really doing as chiropractors. Because there's so many people that just think we crack necks and backs.
Right.
I mean, that's the general consensus of most people. That's probably what you thought.
Yeah, I mean, I know.
Well, I went to the chiropractor and cracked my neck and cracked my back and I felt better. That's
Right.
really kind of a simple thing. But chiropractic's not really about pain. It's about normal homeostasis and neurophysiological function.
And I guess, like, with all of, it seems like a lot of times you said that you're the last resort in the sense of, you know, people have tried everything, they've gone to primary care physicians,
we hear it all the time.
Where would be an ideal point of intervening along that path?
Well, the ideal point of intervening is before they start taking all the drugs and get chemically dependent upon those drugs, and or have surgeries, because once you have surgery, you have scar tissue. It's inevitable. You cannot have surgery without having adverse scar tissue development following surgery. And how do you deal with that? Because it's very tense and tough, tensile, ligamentous fibro tissue, fibrotic tissue, fibrotic adhesions. You've probably heard of like women who get total hysterectomies. They got a lot of abdominal adhesions, and they're painful because they have an increased neurofibril input to those scar tissue fibers, so they hurt more. So a lot of times when you have back surgery, you'll have adverse scar tissue formation and pain just from that, and not properly rehabbing it afterwards and moving it. See, a lot of people go home and they rest in bed, or they're wearing a corset or a brace or something that immobilizes them. What we do is we mobilize them to improve function, as opposed to immobilizing. Immobilizing is old medicine.
Well, and I guess it seems like, I mean, maybe if you said the more progressive physicians are the ones that are making the referrals.
The ones who are more educated in the literature. A lot of medical doctors don't even know their own literature. This is all coming out of PubMed and NCMIC. I mean, you know, not NCMIC, but the National Institutes of Health. I mean, a lot of this stuff is published in medical journals, Guidance Physiology. This is not chiropractic textbooks. This is not something I made up or something that other chiropractors made up. This is coming from their own scientific literature and information that's already been published, and some of it's very old. But a lot of physicians don't know it. And also, there's a huge impact on physicians by pharmaceutical companies in the pharmaceutical industry itself. I mean, if you go see your medical doctor, how many times have you gone into your medical doctor's office and not seen drug reps coming in and out of their office?
That's a good point. That's a good point. Yeah.
They've got whole rooms this big of sample drugs.
Wow. Goodness. That's very true now that I think about it.
So a lot of their treatment is based on, okay, you have these symptoms, okay, well these drugs go with these symptoms,
right,
so here you are.
That's very true. Wow. And I guess, I mean, that's a challenge as we move forward.
It is a challenge because people want to take a pill and get better.
Right.
I mean, they want the easy fix.
Yeah.
Chiropractic's really an easy fix, and it's really, chiropractic's a lifestyle. It's a choice. Just like working out is a choice, exercising is a choice, eating right's a lifestyle choice.
Right, right.
You know.
And how often, I guess, would you recommend, you know, or how long does typically somebody who comes in with chronic pain see you, you know?
That varies per individual. You're an individual, so yours would be different than my wife's or than our patient who's getting ready to come in here.
Right,
I've got an NFL athlete coming in here in just a few minutes that I'm going to adjust, so I wanted to show you what we do.
Yeah, I'd love to
and
see
then explain some of this while I'm doing that, if that's okay.
Yes, I'd love to see that. And I guess just one last question so we can wrap up this part. So is there anything that we didn't touch on that you think is important for us to know?
And we're talking about public health and public health awareness, right?
Yeah, just
in perceptions and
yeah, so kind of the spectrum of you know, moving forward in pain management, and you know, especially individuals that are dealing with chronic pain.
Right.
You know, where we need to go as a society, even at the intervention level.
Okay. Here's one question every single pain patient should ask themselves and their doctors. Where is my pain coming from? Are you deficient on narco? Are you deficient on opioids? Is that the cause of your pain, or is the cause of your pain a biomechanical impropriety that is adversely affecting the proprioceptive bombardment into the cerebellum, causing these adverse neurological consequences and sequelae? I mean, what's the cause?
Yeah.
And that's really what chiropractic's about, is fixing the cause of the problem as opposed to treating the symptom.
And how can we get patients to that point, I guess, of asking that question? And
well, what's the major medium that people watch all the time? Television.
Yeah.
Right? That would be the major thing I would think that would need to be influenced is mass media on this. But, you know, who pays the bills for most of these media companies? Pharmaceutical companies. What do you see mostly as commercials?
Yeah, drug commercials.
Yep. This is this drug.
Right.
And this is the one, by the way, this is a sleep medication that helps you sleep. However, one of the side effects is you may not sleep.
You're right. Yeah, that's very true. That is common. That is so true.
Yeah.
Wow. I mean, it sounds like, I guess when I'm gathering, patients need to be, or individuals need to be more proactive, I guess, on asking questions and maybe advocating.
Yeah, but a lot of them don't, they're not going to know that without some sort of education.
Right.
I mean, unless we as a society start educating through law or through media, people aren't going to know.
That's a good point.
I mean, they're just not going to know because their medical doctor's not going to tell them what I've just been telling you, are they?
Yeah.
I mean, have you ever heard that from a medical doctor?
No, that's a first. Yeah.
So, I mean, they're going to tell you you need to take these pills and come back in 2 weeks, and if that's not working, we'll give you some different pills.
Right, right. So education is really key. And
education is key, not just for the public, but for educators. I mean, even children in school should be taught that wellness is a lifestyle choice.
Right.
It's not a... See, we've become so used to sick care here in America.
Yeah.
You know, so our society has become a sick society that only goes to the doctor when they're sick.
Right.
As opposed to thinking about health and wellness as a lifestyle choice and making the right decisions to accomplish health and well-being, which is homeostasis, internal innate and function of the body.
So it's really shifting that.
It's a paradigm shift, really, to be honest with you.
It's very true.
It's a huge paradigm shift from what our society has become indoctrinated to over the last, 200 years?
Yeah.
You know? And chiropractic's a relatively young profession compared to medicine. Chiropractic was developed and discovered in 1895, so it's a relatively young profession compared to the quote-unquote medical profession.
Oh, wow. I didn't know that.
So, I mean, you're talking about generations of thought processes passed on from parent to child to grandchildren to their children, you know, and when you're sick, you go see your MD.
That's very true. So, I mean, it almost seems like there needs to be
what I was just talking about earlier, a paradigm shift where we're the primary portal of entry.
Right.
Why would you want to go get your arm cut off or your shoulder operated on or your back operated on instead of having me remove the door from your hand?
Right. Yeah, that makes sense. Wow, that's very true. Thank you for it. This has been very enlightening. I really appreciate that.
Good.
Yeah, so I'm going to go ahead.
Would you mind telling our YouTube subscribers who you're with and what this is for?
Sure, yes. My name is Katherine. I'm with UT School of Public Health, and this is a pain management study where we're interviewing different professionals, physicians, acupuncturists, individuals in palliative care, just to learn more about their work that they do with individuals that are experiencing pain, and how they address that.
Well, thank you very much.
Thank you.
I appreciate you coming out.
Thank you for.
And maybe you can help us start educating the public on some of this stuff through UT.
That's the hope.
Because University of Texas Medical School is probably one of the most prominent medical schools in the world.
That is.
And here in Houston, it's all of it.
Yes.
UT Medical Center downtown is huge.
It is. And thank you so much. I really appreciate it.
Well, and I hope this has been enlightening in a good way, and I'm not trying to knock medicine. I'm just trying to change people's perception of how to look at things. If you got your hand stuck in the door, do you want to take pills for that, or do you want somebody to open the door?
Right. No, it's been enlightening in a good way. I think the more professionals I speak with and I hear, more about what you do and the science behind it, it just, we really need a paradigm shift.
Yes.
How you mentioned. I think
That's true.
Critical.
That's true.
Yeah.
Well, thank you so much for coming out.
And
we've got an NFL player coming in here in just a few minutes if you'd like to observe an adjustment to see exactly what I'm talking about with the three-dimensional biomechanics.
Yeah, I'd love to.
It's really, what I do is called BioPhysics, and it's really the physics of biology in three-dimensional, gravitational, weight-bearing, compression stress. Because you're sitting there right now, if your posture is like this, or you're on a computer like this, or you're texting all day long, biomechanically, in gravity, you're in a bad position. And who's going to win that battle over time? Gravity.
Right. That's very true. Wow.
And so you're going to get degenerative disc disease, herniated disc, pinched nerves. I mean, the whole sequela gets started. That's how pain gets started.
Wow. That's a lot to think. That's
teaching children about posture, early on.
Right.
That's a huge thing. I mean, you used to hear your mom say, well, stand up straight or sit up straight, Well, there's a good reason for that. But that hasn't really been top priority in a lot of families in our society because they don't give it that much importance anymore.
That's true.
I mean, really think about it. I mean, how many times do you hear somebody saying, you need to have good posture, you need to eat right, you need to exercise regularly. I mean, it's lifestyle choices.
That's very true, and it's it's complex when it comes to kind of changing people's behavior and.
That's the most complex thing about it is changing attitudes of the medical profession itself, our society, and the lawmakers.
Right.
Because, I mean, the FDA approves drugs as being safe and effective, but yet they take drugs off the market that they approved as being unsafe and ineffective, right?
Yeah.
A lot of them, like Celebrex and what's that other drug that was similar to Celebrex that they took off the market that was causing so many people to have heart disease?
Gosh, I know which one you're talking about, but
I can't remember the name of it. I don't want to get sued by a pharmaceutical company either.
that's a really good point. That's a good point. Wow.
But we're about natural health and well-being, and I think the more people become conscious of staying well as opposed to trying to treat each and every one of their sicknesses and illnesses along the way, they'd be better off in the long run.
I agree. I think that's a good point. That's a really good point. Wow.
Yep. Okay, well, let me turn this off.
I'd love to see. Thank you for inviting me to
You're quite welcome.
see